That's also a very good question, and one that I have heard a lot from many people. So I think this mostly stems from a former Pfizer employee who circulated concerns about the similarity between the spike protein that is on the outside of the SARS-CoV-2 virus and that triggers an immune response in infected people, and the spike protein that we create in response to vaccination, with a placental protein called syncytin-1 that is necessary for placental attachment and maintenance of a healthy pregnancy. So this former Pfizer employee was concerned that perhaps the structural relationship between the spike protein and this syncytin-1 protein necessary for placental attachment could mean that people who either have or have had COVID-19 infection or people who have been vaccinated against COVID-19 might have issues with maintaining a pregnancy or becoming pregnant later on in life. However, that has been completely debunked, and I can explain why and what information we have to support that. So first of all, the two proteins are actually not at all identical. So that's important to say. They are structurally somewhat similar, but they are not at all identical. Secondly, in the world, we have now seen that there have been 187 million cases of people who have had COVID-19, roughly 50% of those occurring in women, many of whom are of a childbearing age. We have documented many women who have been of childbearing age and have either achieved pregnancy, been pregnant when infected with COVID-19, or became pregnant after infection with COVID-19, and have not once observed pregnancy outcomes that were different from people who either did not have COVID-19 infection or were not vaccinated against COVID-19. What I mean by that is that if the spike protein itself were causing an issue, or antibodies to the spike protein were causing an issue with women to be able to maintain a placenta, then what we would have seen is these sheer numbers of women who have had COVID-19 infection, because the human body makes a tremendous amount of antibodies against the spike protein in natural infection, they would have had problems with those pregnancies or an inability to become pregnant after COVID-19 infection. So similarly, we have not seen that the billions of people who have received COVID-19 doses of vaccine in the world have had issues with either maintenance of pregnancy while being vaccinated or after vaccination. So I think people can be reassured to understand that this is not something that has actually been observed. And there are many pregnant women who are being followed very closely either during or after vaccination against COVID-19 because of that VAERS vaccine adverse event reporting system that I mentioned. Questions that are included for all people who get vaccinated against COVID-19 is, have you become pregnant since you received a vaccine, and what the outcome was of your pregnancy? So in the world, we are tracking very closely whether or not women are having adverse outcomes after COVID-19 vaccination, and we have not seen that at all. So that should be very reassuring in terms of later fertility also, because we have not seen any issues with women who've either had COVID-19 infection and been pregnant or become pregnant afterwards, or those who have been vaccinated and been pregnant or come afterwards. Pregnant women have much higher risk of severe and even potentially fatal COVID-19 infection. So pregnant women have an increased risk of hospitalization, particularly ICU or intensive care admission, preterm birth, so preterm labor and delivery of their infants before they're ready to be delivered, and also increased risk of death. So when considering this potential risk to fertility of vaccination compared to what we already know about the severe risks of COVID-19 to pregnant women and women who are trying to deliver healthy pregnancies, it is much more dangerous for women to be unvaccinated and pregnant than it is for them to be vaccinated and pregnant.